CHE Board.
Russ Grunwald, I'm Vice Chair.
Marilyn Moore, Chair.
Michelle Peterson, Funding Chair.
And Lori Seibel, President. And I will let these fine folks take it away.
Okay.
Very good. Welcome,
Thank
Dr.
you,
Moore.
As I said, I'm Marilyn Moore, honored to serve as Chair of the Board at the Community Health Endowment, and glad to have this opportunity every year to update you on the activities of the Community Health Endowment and its present status. And since we've last gathered, we have new City Council members. So Justin, congratulations. Tom, congratulations. I haven't met you yet, but congratulations. Thanks to both of you for serving. Public service at the local level, I think, is the most important governmental work that happens because it affects all of our lives every single day. So thank you for doing that. And the same is true. We have new members of the Community Health Endowment Board. So let's see, Lori, I think you can show those. Yes, here we are. The membership of the Community Health Endowment Board is mostly appointed by the mayor and confirmed by you. So thank you for doing that. Since we met a year ago, 3 of our members retired. Janice Walker and Eric Buchanan and Dan Marvin had all completed their terms, and they were wonderful board members, and we missed them. But change happens, and so we have 3 new board members that you have confirmed. Michelle Suarez and Scott Young and John Goldridge, all wonderful new board members that bring extensive community experience and expertise, and we're glad to have them on the board. There are 3 board members who serve by virtue of position, and that is the CEO of Bryan Health, the CEO of CHI St. Elizabeth, and the director of the Lincoln-Lancaster County City Health Department, Lincoln-Lancaster County Health Department. So Russ and Pat have been members of the board for a number of years, and Tyler DeYoung is the new member as the CEO of St. Elizabeth. So those are the changes in our membership since you last saw us. We're going to do just a brief update today of several activities of the board, and then would be glad to respond to any questions that you have. This is, if you've not heard, this was our 25th year celebration, and it really is it's a significant celebration, and it, I believe, is a significant asset to this community. There are not very many communities that have an asset of $70 million for the purpose of making the community the healthiest community in the nation. And that's the purpose of the Community Health Endowment. Great foresight on the part of people 25 years ago plus who established this endowment and put in place this asset to carry out that mission of making Lincoln the healthiest community in the nation. At our 25th year celebration, which was attended by past board members and other dignitaries in the city of Lincoln, board members talked about how they were honored to be part of that purpose, to have as a mission the health of the community. And it was an uplifting opportunity to hear people's stories about what brought them to the board and how meaningful they found it. And I think all of us would say that of all the boards we've served on, it is one where we have learned the most, because in the course of our time on the board, we interact with so many of the nonprofit agencies in Lincoln who are part of that effort of making Lincoln a healthy place. And we just learn a lot about the community, both the nonprofit world and the government world. So we're grateful for that opportunity. And it has been a huge benefit to the community. Some of you may remember from a report that you read that the endowment, when it was established, was worth $37.8 million. And in that time, investments have happened, wise investments. We have a good professional council, and we have members of our board with investment expertise. And in that time, according to this graph, you would see another $30.2 million that has been earned through those investments as of the end of December. And of course, the first quarter is shaping up to be a nice quarter in the investment world. So we're looking forward to that end of March report. And the significant number is that $40 million has been invested back into the community in a variety of activities through a variety of agencies, with that mission in mind of making Lincoln the healthiest community in the nation. So with that setting, I'm going to turn it over to Michelle, who's going to talk about that all-important grant-making work that happens.
And the funding committee meets and reviews the Place Matters information and looks at funding priorities. This year we reviewed that and found that these 4 groups were going to be our focus for the funding priorities this year. Early and adequate prenatal care, and that's looking at, once again, the mapping, looking at geographic disparities, and with the focus on the low income and minority women. The other is healthy food access. Through that mapping, we can see that there are areas that have limited food access, and focusing on those during the grant process. Youth fitness is something that we're finding as we come out of COVID, as well as looking at the history, that this is an important area for us to be involved with, as well as mental wellness and human connection. And those were the priorities that we established prior to the funding cycle this year. Several of the different projects, the one just as an example is the maternal wellness, and that was funded through the Malone Center. It looked at BIPOC individuals with a focus on prenatal education, nutrition, doula services, breastfeeding support, and that was very successful. There was a lot of positive things. Back to the endowment from that, also the Trauma Warriors, and that is a grant that was to the Native American Youth Council to look at promoting wellness and community engagement. And it's fun because one of the things that we do is do site visits on these areas. One of the things too that we look at is looking at different ways to promote those goals in the community. And the Visionary Youth, the Mentoring in New Dimensions, actually using a mobile barbershop to get in touch with the youth, to provide counseling to high-risk individuals, and it can go from place to place, which is great. 24 men from the Malone Center, as well as Cedars, Goodrich Middle School, to bring them on, cut their hair, chat, have a good time. And this picture is actually from the site visit where they came to visit us, which was great. We got to get on and kind of, it was wonderful. And it was great to see what we had been hearing about and actually get on board and take a look. So it was pretty cool.
This grant just started, so the 24 is just the very tip of the iceberg.
Right.
Yeah.
We have been doing legacy projects. This is our new one, and it is the ACES Institute, and that is the Adverse Childhood Events is the ACES. Actually, this is through the Brave Bee facility, and it's really looking at public education and looking at professional training through all different aspects, and increasing community expertise regarding those events. So it's something that we're excited about. We've been involved with some of it already, but we've designated this just because we know that on the long term it makes a huge impact in the health of Lincoln. Our ongoing project right now is the Cultural Centers of Lincoln, and that is developing a welcome center and partnering with the different cultural centers in Lincoln. And just some of the different things is the Welcome Center, the Asian Community and Cultural Center, El Centro de las Americas, and also the other facilities that we're hoping to get into one general area to do something exciting in Lincoln. Site visits, as I talked about, it's our opportunity to go out into the community and actually meet with the people that we are funding, see the projects, get a glimpse of the facilities, as well as talk to the people, which is really great. Like Marilyn said, it's a great learning opportunity, and one of the really cool things that we get to do as board members is go out, meet the people, and see the progress and see what's happening. So that's been fun. And I think that's it.
All right.
Blake, you're up.
Very good. Well, very happy to report that the 2023 was a really good year for the CHE investments. They grew 16%, which you can see on the far right figure in the blue line. So 16%, which is equivalent to about $9.6 million in investment gains. Really especially welcome news after a tough 2022. The investments have 75%, so the other two graphs you see are the equity, the S&P 500, and then a bond index. The investments have 75% equity exposure, which has been the primary driver of the growth in 2023, but the fixed income has done well to aid in moderating some of the volatility. As of the end of 2023, the investment value was around $68.1 million. Although this is down from the high water mark, the strong growth in 2023 has allowed us to inch closer to a return to normal funding levels, which Russ is going to talk about here a little bit on the next slide.
Great, thanks. So a year ago, when we came before this group, we had to deliver a tough message. As you recall, and has been stated, the corpus of the CHE has to continue to grow at a level consistent with inflation, and then we make grants above that. And last year at this time, the market had gone down significantly. Inflation projection, actual inflation had gone up, and therefore projections had gone up, and that left a big delta between where we were at and where we needed to be to maintain that and continue funding. So we let you know last year that we had suspended new funding. We still had ongoing funding that it was our intent and we were able to keep up with, but the spring grant cycle we suspended and did not do any new grants in the spring of 2023 and put a 10-year glide path in place whereby through sort of normal inflation and expectations around the investments, we'd be able over time to get back to a regular cycle of funding. The good news is 2023 was much improved over that. Not only did inflation come down, but of course you just saw the big increase in our investments. So we're back up to a place where we could begin some limited grant making in the fall of 2024. So we did do some limited new grants. And now we're back at a place, we're not back completely where we want to be, but we're at a place where we believe we can resume full funding, and we have a full grant cycle that we're looking at in the spring of this year. We're reviewing 43 grants for funding, and we'll be looking at what that will look like here in just coming up in May, and then again another cycle in the fall. So really pleased to be able to come back a year later and say we're way closer. We're not all the way through back to where we wanted to be, but boy, we cut what we thought 10 years would be in half at least, if not a little further than that. So really a good year and excited to be doing that again.
We're all sleeping a little better. So just a quick update on a few other things, and I've come and talked to you about our Place Matters. We did release that this year, our 5.0, and I'm only going to mention that we continue to go out and talk about this in the community. I think a month doesn't go by where I don't go out and talk at least once a week to an organization about this. Some people have told me that it is now their planning tool. Folks at a local nonprofit here with a very large reach told me that they consider it their largest economic development tool because of how many grants it's been able to bring in. Really helps people talk about their community and the issues better, and so we're just grateful. It started out as an internal planning document, but we're grateful that the community is also using it. And as Michelle said, we use this to set our funding priorities, and so much of what you'll see, the board has said these are the areas where we really need to focus because we believe the data says that's what we should be doing. So in your packet, if you don't have a copy, is a copy of the latest Place Matters. And I'll also mention, of course, we do this in very close collaboration with the Lincoln-Lancaster County Health Department, and we did publish a Spanish version this year for the first time. And so we're excited about that, and if you know of anyone who needs a Spanish copy, please let me know. We have plenty of these as well. We did several new maps this year, but I decided to just mention one again that I think may be helpful to you as a policy-making organization, and that is the Social Vulnerability Index. I kind of call this piece of data kind of like, data stew, right? You take a bunch of really good data and you put it together and mix it up, and it can kind of tell you a bigger picture about the community. So this one takes socioeconomic status, household composition, so for example, single-parent households, minority and language, as well as housing, and then kind of looks at if there is a event, if there is a difficult circumstances, say a pandemic, something like that might happen. God forbid, it would never happen again. But where in the community the investment should happen first? Where should we reach out and begin to work with the community first? So this purple area would say, when stuff like that happens, here's where we go invest first. Here's where education on how to get resources. Here's where perhaps translation of materials. Here's where transportation might need to be happening first. So in the case, again, I'll use pandemic, this would really be able to guide a city to say, okay, let's really invest here first. And so that's how a grant or a map like this might apply to your work as well. And then, as we mentioned, we picked prenatal care. We believe that that's kind of, a preventive thing that we should be really doing well in our community, as well as healthy food access. And, youth fitness. We saw the pre-COVID and the post-COVID rates, and we know that they're headed the wrong direction. And so what you'll see here is a real movement toward prevention, a real movement toward upstream issues, really trying to prevent things from happening instead of waiting until they happen and then respond to them. And the board has felt very strongly that we need to make a move toward a more preventive approach. And the same is true in the area of I skipped, but mental wellness and human connection. How do we keep people mentally well? How do we keep kids mentally well? But also, how do we implement new strategies like peers into the work, which can add another layer of support to prevent bad things from happening down the road. So you will see decidedly a focus on upstream approaches in the latest funding. A couple of other things I just want to mention. We love being able to raise issues up in the community, especially things that are emerging. We have what we call community conversations. We had one on the power of mentoring. Great to hear what mentoring, again, an upstream approach, is doing in the community, as well as embracing cultural diversity in healthcare. How do we get more and more of our workforce to not only be culturally responsive, but actually have people of color more often seen in those healthcare fields? And I know that Russ would be happy to talk to you about the work that Brian is doing in that area. Just as an FYI, we are having, just on Friday, our latest community conversation about peer support, something I mentioned, and we've had a great, I think we have over 100 folks registered for that already, and so really eager to hear about the role that peer support can play in our community. So feel free to register if you are so able. A couple of other quick things. We're part of a group that's talking about Meals on Wheels, and this is the kind of thing that people often come and say, can you help us talk about this issue? So we provided some funding for a facilitator to come in and bring the community together, talk about how we're going to address the issue of Meals on Wheels. It's a complex one, but if any community can solve it, I think Lincoln can, and there's right now about 15 folks around the table who are working really hard, and I'd be happy to update you on that as individually you would like. We've been working quite a while in Belmont, and I know some of you are interested in that, but we have also been providing strategic planning sessions for that neighborhood on how they can use their neighborhood, their facilities, their amenities, their assets to create a stronger neighborhood. And we've just seen some really positive things coming out of there, and we're excited about. They just met the other day about their pool, because they want their pool open.
Mm-hmm.
I'll just tell you that now. And so how...
We're aware.
You're aware. And how can we as a community, can they advocate for that to happen? So we're excited about the work that's happening there. And as you know, there's just lots of other meetings going on, and we try to present that data approach, and we also, the answer isn't always money. The answer sometimes is just helping folks bring in expertise, bring in strategic planning, perhaps from time to time bring in a little seed money to help things happen. Looking ahead, we are in the middle of creating the Youth Fitness Sports and Opportunities Task Force. Some of you are aware that we did some research around this topic in the community, primarily related to those maps that show youth fitness is indeed a troubling trend in our community. So we're beginning to work on that, and you'll be hearing some information coming out about that. And we're also working closely with the mayor's office. We extended an invitation for Dr. Murthy, the U.S. Surgeon General, to come to Lincoln and talk about social media use and youth mental health. My understanding is he has accepted our invitation. I don't yet know the date. I'm getting a little anxious about that, to be honest with you. And it's not really good for my mental health at the moment, but I'm hoping that that we find out soon, and certainly we would love, you guys to have be involved in whatever discussions he brings here to Lincoln around that topic. So I always end by saying this group is happy to answer any of your questions. We always love and appreciate the opportunity to come and tell you what we've been doing. I want to recognize our staff who work so hard, Morgan Hermanic, who is here, as well as Emily and Kyra, who are back at the office working hard. They're a strong group, and I really just enjoy the opportunity to work with them, and I appreciate all of your support as well. So however we can help you and whatever questions we can answer, we'll be happy to do that.
Thank you, Lori. What questions do we have for CHE?
I have a couple questions. Are there things that are not being measured currently, either through the health department or through the community, that should be measured or that you would hope would be measured?
I think there are things that I wish could be measured that are difficult to measure. Anything around mental health is very difficult to measure, but there are some things that over time we're able to kind of glean a little bit more from. But I can tell you, the question in Lincoln is not so much, do we have the data? It's how do we use it? And how can we continue to create opportunities to put it in people's hands that really craft solutions? I'm a big data believer that the data should drive it. We have lots and lots of data. Sometimes it's just how can we continue to push it out in front? I don't see a lot of gaps personally, but I'm sure others would disagree with me.
Because I guess when I hear the social media component and knowing that social media is now, kind of a hot topic, I don't even know what measuring that would even look like, right? Or are there things that you believe will be big priorities for CHE, or that the city should have a heads up on how the city should be addressing? Does that make sense?
Yeah. I would say one of the biggest trends that we have to, and I know there's already been some work around this, but is our aging population. I think that is an absolute, we're at a critical juncture when it comes to that. Talking about saving Meals on Wheels at a time when our senior population is going to explode, we have to figure those kinds of things out. Housing, workforce, not only in hospital settings and places where we're going to need more and more people to care for people, but also because more and more people are moving out of the workforce. Transportation, how are folks going to get around? All of those things, I think, are, if you had to ask me one thing that I think is going to be front and center more quickly than we know, it's going to be our aging population.
Long-term care is absolutely in a crisis all across the nation, not just in Nebraska. And so it affects so many elements of the whole health system. And the other one, we do talk about it, the other one is childcare. If we can't figure that one out, and boy, some long-standing, well-supported places that have decided they can't support it any longer, I get it. But that's going to play havoc in lots of different ways, not just workforce, but other ways as well.
I agree, and I think it's one area where the data is still a little bit hard to get your hand around is early childhood. But I absolutely agree with you. I'm going to go as far as to say the two places that most communities have failed, and I use that in a broad sense, has been supporting people who work in early childhood and people who work in long-term care. Those populations, those staffing issues, the model is so upside down that it's just it's not gonna be little changes that are gonna fix it. It's gonna have to be something big.
Other questions? I'll jump in here really quickly. I don't know if this is Russ or Blake or both of you, but can you guys talk a little bit more about the 10-year recovery plan and what that necessarily looks like? And then are you adjusting your investment parameters in order to try to hit new marks, Blake? Or what does that look like? Because I mean, from my point of view, as quickly as we can get back to the past ideology of CHE traditionally investing $2 million of brand new funding out into the community every year, the better. But I don't know in terms of this newest granting cycle or how you think ramping up over the next 10 years looks like. I mean, what does that look like, I guess is my question.
Yeah. So I think one of your first questions or statements, so we haven't adjusted our asset allocation. So we're kind of staying the course in terms of
Where
the
you
asset
are.
allocation and not trying to take on more risk to try and get those returns back quicker. But as far as the 10-year, and Russ mentioned this, the 10-year plan is ahead of schedule. And, we're back to, closer to 100%, but not all the way there. One of the things that we are looking at, and so I guess the way that we've addressed, the funding shortfall is to limit or to reduce some of the funding amounts. We're getting closer to increasing those amounts from where we were a year ago.
Okay.
And candidly, one of the other big pieces that we're looking at over the next few years is our legacy project with the cultural center. So that's
Right.
got a fairly significant outflow. The timing is a little uncertain of when those funds might come out. So that's the other piece that we're trying to incorporate, that
Okay.
we don't have, we've got enough funds for that project, but not at the, at the expense of other valuable projects that come in through the normal funding cycles.
Well, very selfishly, I always look to CHE as being a transformative leader in the community when it comes to how we approach health-related items. You guys not only can convene groups in ways that no one else can, but also have the majority of the time the funding power in order to make things happen. And those are two very unique characteristics that I don't know that any other facet of the Lincoln community has at the same depth that CHE does. So I am anxious, Blake, to make sure that you are getting back to that full funding cycle as soon as possible, even though I understand it may be longer than I want it to be. So.
Well, don't tell them about the crypto strategy.
Oh, Blake, that's not in your investment parameters. Other questions? Yes, Michelle.
And the committee, the endowment feels that way too. That's one of the things is we always are interested in how that plan is progressing, because we want to return those funds. That's our job. We want to get there. So we're all in the same
Yeah.
boat as far as returning back to that level, but not at the cost of the future.
Of course. Other questions for the board? Tom?
Lori, fentanyl's getting to be a big issue in a lot of communities, and I just kind of wondered, has there been any thoughts of putting something, education in place, that sort of thing, when it comes to prevention?
Nobody's really approached us about that. Of course, we fund a number of substance abuse treatment as well as education programs, but nobody has really approached us specifically about fentanyl. So we would, certainly be interested in learning about it.
Just, I rode with the fire department about a month and a half ago, and I was amazed at how many fentanyl overdose calls they handle. So it seems to be an awful lot.
Other questions?
I don't have a question, but
Yeah.
I just have an immense amount of gratitude for the work that you do, and the research especially. I love the so fluent in Spanish now. I'll pick up some of those. But I just thank you so much for leading on the research, and I have strong interest in many of the areas that you guys research, and I certainly want to continue the conversation about youth and fitness.
With that, we are past our deadline. Thank you all for the time that you give to the Lincoln community.
Thank you.
Really appreciate it.